what are the skills that you're building off of. So really appreciate that. I just got the little notice from Michaela that this time together is being recorded. And so just wanted to let you all know that. Um, and, hopefully, like, Michaela, will they be able to have access to the recording afterwards, just in case?
Yes. Yeah.
Great. So why don't we get started kind of with some level setting, which is like, why does community engagement matter? And, at least for those of us in Minnesota Department of Health, what does it look like from the structural and staffing level with Nancy and Lucas? So I wanted to do a little bit of storytelling first, which was like why I've seen, when I've worked in with the AAPI communities, specifically with the National Coalition for Asian Pacific American Community Development. And I started that job in 2005, literally like 2 months after Katrina. And one of my key projects was supporting the rebuilding of New Orleans East, post Katrina, which was a Vietnamese American enclave. And we were really supporting the community to not only just come back, but have a voice in how that coming back was going to look, how the rebuilding was going to look, and how sort of systems and structures to support the community was going to look. And what we saw was that residents were returning and received support from federal agencies to rebuild, but there were some pretty big handcuffs to rebuilding. And one of them was actually environmental hazards. Waste management was dumping trash and chemicals into a canal that went directly into the groundwater of New Orleans East. And there was a real concern because, the residents had a lot of really big ideas, which is really exciting. They wanted to have community gardens. They wanted to have like playground. They wanted to have all of those things. And that would be really hard to have if the groundwater was contaminated. And also, they were going to make that sort of like structurally something, that hazard structural in terms of building a landfill area adjacent to the New Orleans East neighborhood. And that was a real concern for everyone, the residents, to rebuild. And what we loved and really appreciated was you all in environmental protection showed up for this community. The community said they would not have been able to rebuild without your partnership and your allyship. And what does that look like? State and local environmental agencies made connections with the EPA to actually explore violations of the Clean Water Act. And one of the things myself and the residents of New Orleans East realized was like, sometimes the threat of action is more effective than the actual action itself. And so being able to get from the state and local environmental agencies, folks like you, what we could threaten them with was really important. Knowledge is power, and these state and local environmental agencies gave this community a lot of power. And also they were able to provide data and GIS mapping about where the waste was going. So they actually, gave the community like a lot of data and really partnered with the community and showed up for the community. I mean, it showed up both in like those technical ways of like, how do we track the impact of like, polluted groundwater, and also in the literal ways of like, we had folks from state and local environmental agencies actually show up to hearings and be like just warm bodies to show how much support they had to stop the landfill from being established. And they also leveraged on the ground, their connections with researchers at Tulane to start documenting what's already happening, not just what had happened, but what was already happening. So I think this was one of the things where I still hear, essentially, 20 years later, how much that community appreciated and really like sort of recognized how folks like you in environmental agencies were actually showing up for them in a way that was really about support and mutualism, and it was the fact that, you all became a trusted partner to this group. And what came out of that was the landfill never got approved. Actually, Waste Management was cited for the polluted groundwater and had to do cleanup for that. Off of that, the New Orleans East community has the Mary Queen of Vietnam Community Development Corporation, that is a community-driven organization to continue to map out, chart, and develop that neighborhood. And coming out of that, they launched a Vietnamese language immersion school. They created community gardens, and they provided small business loans for businesses to open in the neighborhood. Things they could not do without your partnership, because they would not be able to rebuild in that way with that kind of robust energy if they knew their groundwater was being polluted. So I just wanted to sort of set the stage for you all about like why community engagement is important, not just on our side of like, to get people to fill out surveys and stuff like that, but on the side of the community where they know that I think our network, our sectors are a sleeping giant for movement building. And when we make ourselves available and we have trusting partnerships, that means that we actually make real change. And the ripple effects, I mean, this is 20 years later, and this is the kind of stuff that's happening. So the ripple effects are profound. So that is just to set the stage about what the stakes are. And I wanted to put the stakes as something great and exciting because it is. And there's a lot of appreciation there, even 20 years later. So what does that look like at MDH? Nancy, do you want to go first, or do you want Lucas to go first? You're off camera, so I just wanted to double check. You're on mute, Nancy.
I'm fine with however you have it lined up in the slides. I'm next. That's great. I'll start in here. So yeah, and just again to set more of the stage, we were talking with our environmental justice work group here, and we wanted to do a training for a long time, but we're kind of trying to figure out how to apply some of these concepts of chemical. A lot of us working in chemicals, obviously with the Interstate Chemical Clearinghouse, and how to apply that to environmental justice. And while we know there's a little bit of data out there, there isn't a lot, and just trying to figure that out. So what I'll present here is the basic beginning of what we're trying to accomplish with our little world of work at Department of Health, where the unit that I work in, and I see a lot of them have joined today. So hi, everyone. Glad you're here. Feel free to jump in. A lot of them helped me work on the statement that we created for a document. And the document is for a rulemaking. As I was saying, in our unit at MDH, we work on specifically water guidance, is what we call it. So they're concentrations of contaminants that are found in groundwater that can be used as a way to determine if the water will pose little to no risk if it will be consumed over a certain amount of time. So we're creating basically concentrations or values that are deemed to be okay for consuming groundwater. And I know a lot of you are probably familiar with it, but when I talk with other people who aren't in this field, they're like, well, I don't want any contaminants in my water. Why would we do that? But of course, as we know, sometimes it's either impossible to get out or it's extremely expensive. So we kind of just have to make that compromise and figure out what's okay to drink once a water body has been contaminated. And so what we're doing right now is rulemaking currently under a requirement by the Minnesota State Legislature. And this time we wanted to include a little bit more related to environmental justice and health equity as we developed our rule. So we came up with a health equity and environmental justice statement. And it's just, again, kind of a beginning, a place to start with our work. We've also been doing other things outside of rulemaking related to environmental justice and health equity, like talking about ways that these can be incorporated into the guidance when we have the data available to try to figure out, when there's information available about communities being exposed, or maybe even more toxicological information that maybe could be applied as guidance is being developed. But in this case, we're focusing on rulemaking too, and some statements related to that. So if you want to go to the next slide. So this actually shows a surface water body, but it's to illustrate that sometimes we're looking at water bodies that are contaminated, and we want to figure out a way that we can talk about the health risk limit rules that are the concentrations of a chemical in groundwater that pose little to no risk to human health. And I should mention that sometimes, even though our values have been created often for groundwater, especially in our health risk limits program, there's also another program called the CEC program that also looks at contaminants in surface water as well. Just the way our laws are set up, we can't put something into rule right now if it hasn't been found in groundwater, but if we do have a value for groundwater, it sometimes is also applied to surface water. So just kind of some background there, and it can be quite confusing the way our laws are set up, but that's how it is. We are authorized in statute to create these, and sometimes we're directed to create them, as we were in 2003 by the Minnesota legislature. And we've been revising these rules over many years. The first round was in 1993, and we've done 9 different of these rulemakings since then. So we've been doing this for a while over the years. And if we go to the next slide. So this time we created a statement, and it's not a very long statement. It's just a couple paragraphs and a couple bullet points, but it talks specifically about sensitive populations, which we have been thinking about for several years, but we've never actually put it forth quite in this way in our document, which is called a Statement of Need and Reasonableness. So we have what's called a SONAR, which stands for a Statement of Need and Reasonableness. And we wanted to specifically state in that SONAR that we're thinking about some of these issues related to health equity and environmental justice. And particularly when we're developing, or the tax team is developing these water guidance values, they are considering children, which we know can be at higher risk for contaminants in the water, especially at critical development stages. So that would be fetal development, infants, and then young children are particularly of concern. And so if you go to the next slide. So the statement that we developed is part of our SONAR, or Statement of Need and Reasonableness. And we worked in collaboration with Lucas, who is going to present another study here in a little bit. But Lucas was able to help guide us through getting the statement created. And we also talked a little bit along the way with our tribal health liaison. And we're trying to get more input. This is why I contacted TC too, to begin with, to get a little bit more input and help with this. And we also worked with people in our unit. So our contact with the tribes was initial. We hadn't really contacted them specifically about the health risk limit rules before. We are still open to meeting with the tribal health directors. We haven't been able to do that quite yet, but I think it was important to at least call our attention to this issue, because they have tribal lands in Minnesota that they have their own environmental health departments for in some cases, and they are considering how to address their own groundwater. So it was kind of another way to let them know that, we're also working on this, and they can contact us and work with us if they choose. So we'll see if that goes further in the future. And then we do plan to keep updating and revising our statement as we move forward. This is just kind of our initial trial with it to see where this goes and see if we get any comments on it maybe. But we do hope to continue to do efforts like this going forward in the future. Now, as far as the actual statement, I was hoping to share that with everyone today. It is part of our sonar, but the sonar this afternoon, just as we speak, went to the commissioner's office for signature. So it's not actually out there for people to see just yet. I was hoping we would be a little bit further along, but hopefully it'll be assigned today, and then I can provide it for people to take a look at. But I am going to just read some of it and do a little summary, and then hopefully we can make that available to everybody very soon. But the statement itself says that clean and safe drinking water is essential for good health of all people. And MDH, which is Minnesota Department of Health, has methodology for assessing the potential health impacts from contaminants, and they are designed to protect those who may be at higher risk for health impacts from potentially dangerous exposures to chemicals and intrinsic biological factors that potentially increase susceptibility to adverse effects from chemical exposure. And we acknowledge that there are communities of color, those in some rural areas, and people with disabilities continue to experience higher rate of environmental contaminant exposure due to systemic policies that result in increased risk for adverse health effects. And there's growing awareness that non-chemical exposures and stressors can be associated with socioeconomic status, with racism and discrimination, or other status like sexual orientation and disability status and genetic disposition, and that these can act on their own or independently to affect health as well. So we're striving to consider all of these factors about socioeconomic and societal considerations when we are developing water guidance. What we are currently doing, as I mentioned, is to think about children, especially developing fetuses. So that would be pregnant women, and also infants that maybe intake their milk through bottles, so through formula, and it's being mixed up with water, maybe that's coming from a tap in a contaminated area. So we're trying to think about those populations as well, and adjusting the guidance to ensure that they are not exposed to too high of level of contaminants when they're existing, and then trying to consider other stressors when we have that data available. And we're also using, and we have used this for years, but maybe more intensely than in previous years, or more scrutiny with the relative source contribution factor, or RSC, where we can maybe think about other exposures that are happening, or environmental justice areas where we maybe hadn't incorporated that into the equation before. So we're just trying to figure out how to get that accomplished. So ultimately, we would like to ensure that all communities have exposure, or that have access to safe drinking water, and that we're committed to sharing our methods for deriving guidance with communities around Minnesota through meaningful engagement. And we have the ultimate goal of ensuring all Minnesotans have access to clean and safe drinking water. So as I said, that should be available hopefully soon. Maybe it's being signed as we speak. So we can make that available for everybody to take a look at soon, hopefully. But in the meantime, are there questions or comments? Or my group, feel free to jump in too if you have anything to say about this process and what we've worked on here.
And if not, we can cover more of that in the actual conversation piece of that. But I will say that as somebody who came from philanthropy, I didn't know the power of rules and statements until like I was a funder, because several of my grantees used their grant agreements to do equity work and sort of mitigate pushback, because they were like, it's in our agreement, sorry, we were committed to it. And, it is some of those things like statements, policies, regulations are really powerful tools for community mobilization if we let them know they're there. So, Lucas, why don't you introduce yourself and tell your story?
Yeah, thanks, TC. Really happy to be here with everybody. As I've mentioned, my name is Lucas Simmons. I'm the Health Equity Strategist for the Environmental Health Division here at MDH. And really what I'll just kind of touch on here is kind of like the process of actually embedding equity and sort of like how that kind of came to fruition through this specific position in a government agency, which is a relatively new model. And if I'm not mistaken, like one of the only models like this within the country. So it's a really sort of unique position that allows folks to kind of build capacity to actually advance health and racial equity sort of at that structural level and kind of so on. So let's see, next slide, TC, please. Thank you. So I just wanted to start by just kind of noting, what is sort of the health equity strategist model, or what is a health equity strategist? So this is just really kind of a quick kind of description of the model, but ultimately, it really exists to embed health and racial equity across the Minnesota Department of Health. And this is done through capacity building, so sort of trainings, knowledge sharing, provisioning of resources, really creating and promoting an environment where individuals, staff, leadership, whoever it might be within the organization have the tools, knowledge, and resources needed to actually operationalize health and racial equity. I think a lot of times they can be sort of this nebulous, very like conceptual sort of idea, and a lot of people are very with that. But then there's this sort of task of sort of bridging the gap and actually actualizing that in the work that we do every day. So that has been really a large charge of my position thus far, which again is a relatively new one. I've been in it for about a year or so. So we're still kind of working things out as we go, but have done some good work in the meantime. So like I mentioned, we work pretty closely with our divisions. There's 10 of us total. I'm, like I had mentioned, in the environmental health division. We have folks within our sort of emergency preparedness response, human resources, for example, infectious disease, child and family health, all spread across the division. And what we do is really work with leadership and sort of staff in, like I said, building that capacity to do health and racial equity work at MDH. So this could look like providing strategic direction within the organization, making sure that there's alignment with MDH's broader health and equity goals. And then, actually working within the cohort as well. So with my 9 other colleagues that are strategists to really sort of develop tools and resources to be able to, kind of operationalize this work in a somewhat uniform fashion, making sure that there's a shared understanding of definitions, shared understanding of sort of concepts, sort of, frameworks that we're utilizing to actually operationalize this work. Next slide, please. So with that, I wanted to just touch on a few of the key responsibilities of the health equity strategist to kind of help sort of paint the picture and to help folks kind of understand as well sort of how I kind of come into this picture in terms of specifically helping Nancy and the team with the equity statement within the sonar. So key responsibilities, really supporting division leadership. We work very closely with our division directors, assistant division directors, and managers to really sort of integrate and implement and then track the progress of MDH's strategic goals. The tracking portion, I would say we're still kind of working out. We have a data and evaluation team that is assisting with that, but really we're acting as sort of like the node between sort of all of these different entities within the agency to be able to advance this work. So to that end, we're establishing clear paths for coordination. Really being able to connect folks within my division, so specifically EH, for example, with the Office of American Indian Health, Office of African American Health, Diversity, Equity, Inclusion, Belonging, whatever it might be that might have these resources that can advance this work specific to the division that we're working in. And then also, like I had mentioned, sharing those resources with the other strategists as well. There's always something to learn from, and we each bring sort of a wealth of knowledge and understanding, personal experience, lived experience to the job. But since we're seated in different divisions, it can look a little bit different. So that knowledge sharing is hugely important for how we're actually going about doing this work. And then, like I had mentioned, we're also sort of, developing tools and resources. So building that capacity, enabling staff to be able to understand that the work that they're doing has these equity implications, and that this is really central to public health work. Making sure that folks really aren't being left behind, and that the folks that may have been sort of historically disadvantaged in the past are now kind of being brought to the forefront, centering their needs and their concerns. Next slide, please, TC. Thank you. And then I just wanted to touch on just sort of a couple of the benefits of having sort of a position like this within a government system. Governments are very, very siloed, or at least in my experience. I've been here for a year, and that's what I've gathered thus far. It's siloed. Information sharing is not often easy, I think, within divisions, but especially across divisions. We're able to really sort of connect those dots with folks. We also have, it allows for a designated individual to help really strengthen and amplify the equity work. So again, connecting to maybe something similar that might be going on, or resources that another division might have that strategist can then share with me or another one. And then because we're working in a specific division, it allows us to become very familiar with the work of that division, offering, this sort of individualized approach to embedding equity. Like I'd mentioned, we're all trying to sort of advance this work in a somewhat uniform way, but there's going to be some variability just with the work that the divisions do, and just how, just the breadth of work that MDH does as a whole. So having that sort of individualized approach, I think, is essential, because when you're doing equity work, you'll likely come to find that it's really not a one size fits all. You have to have very specialized approaches for how you go about this. I would say externally with engagement, but also internally with how you're working with individuals within a certain organization or system. And then, like I'd mentioned, resource sharing. So connecting, the health equity work with the broader work at the agency. One of the benefits of the strategist position, I would say, is that we're seated both within our respective division, but also within the Health Equity Bureau, which is sort of the central bureau, at least at MDH, that is really kind of putting these resources together, really trying to advance this work. And with those resources, we're able to bring some of those back to our divisions to share. I think in particular with best practices and sort of the offices that are housed within the Health Equity Bureau. And then I had mentioned some capacity building. So what that might look like is certain trainings. So we do sort of like a health equity 101, 102, sort of these foundational sort of trainings to help people sort of build their knowledge and understanding, especially with sort of just like shared definitions. So like I mentioned, equity work can be a bit nebulous, a little heady at times. And then we also can talk about stuff like community engagement, get more specialized. For example, I'm doing a training right now with our drinking water protection group, where we're really trying to tie in, some of these more foundational approaches, but then also getting people to realize that, the work that they're doing is indeed equity work, and this is what that looks like. So getting folks to kind of understand that, kind of bridging that gap that I'd mentioned earlier. And then finally, also best practices and alignments. Providing folks with the knowledge that they need and that they feel comfortable to be able to do this work. I think a lot of times, you don't want to say the wrong thing or sort of be sort of in the wrong. And with that, there's some hesitancy in doing this work. So being able to provide these sort of best practices, people are feeling a little more comfortable to then actually take that deeper dive into operationalizing equity work. And then I mentioned alignment as well. We're able to, through sort of strategic planning and working with our division leads, so our division directors, assistant directors, sort of at that higher level, we're actually able to embed equity as, within our policies, practices, and procedures, and make sure that those, again, are in alignment with MDH's larger sort of strategic vision in terms of embedding equity. And I think that was the last slide, TC. Oh, just kidding.
Yep.
Oh, wait, it is.
No, that's your last slide. And thank you so much. And not, I just want to acknowledge that not every health department has a Lucas and his team, but I think what we wanted to lift up is what that role could look like within your own health department, how because there usually are equity staff, and how can you cultivate them the way it's kind of baked into Lucas's role to support Nancy's equity work. And we just wanted to lift that up. And so we're going to get into the conversation part of this. And these are the kind of some of the questions that came from you. We kind of like grouped them into sort of like, because there was a lot of questions about like, how do we actually compensate community members, knowing that we can't, I know we have at MDH real regulatory handcuffs that say we cannot provide stipends or gift cards or things like that, things that like we know at the community level are really best practices. And so one of the questions that we're going to be talking about in the conversation is how can we provide value for environmental justice and community groups for our common goals and priorities? And then the other one is like, how do we ensure like those relationships start off in a way that ensures sustainable, impactful outcomes? How do you start on the right foot? Was a question that really came up from when Michaela was sort of asking the groups. And then how does that table for multiple stakeholders, grassroots organizing groups, for-profit companies? One of the questions was about like, how do we engage businesses in this and government agencies? So that's what we're going to talk about. And I did want to lift something up from the chat, which was Lizette had said, we're also looking to expand and clarify our definition of sensitive subpopulations in our regulations. Lizette, do you want to come off mic or put in the chat, like, what are the things you're thinking about, like in terms of sort of expanding and clarifying that definition?
Yeah, I can speak on that a little bit. So our definition right now, we do mention sensitive subpopulations, but in that section, we also mention pregnant women. So we wanted to make it more inclusive and say pregnant people instead. And then we were also thinking to be more explicit that that definition includes populations impacted by environmental injustice, and then also Indigenous people or Native nations. So just trying to be more explicit of what kinds of populations would be included in that definition.
And Lizette, I really appreciated when you were talking about it, that there's flexibility and nimbleness in that as well, because we know community context is everything. So sometimes it's not a hard and fast one, but to be able to sort of name who you're focusing on as those most impacted, and communities can really do that work and work with you to determine who is most impacted, because it's not a one size fits all. We see that especially in Minnesota, where we have, even within the same county, rural areas, suburban areas, and urban areas. So there isn't necessarily a one size fits all. So what I heard from you there was like, there's both wanting to expand and really be clear, and also be nimble with those definitions as well. So my question for you, Nancy and Lucas, is how are you, like, what is as you've formed and created the statement, what was your pitch to the communities that you were working with to help inform that, in terms of what they were going to get out of it and the value that you were going to give to them? Because sometimes engagement is about like both the ask and the offer at the same time. And how did you pitch that?
Yeah, thanks. So that's a good question. I think, we're still at the very beginning stages, and we're just trying to get our head around how to incorporate equity more in our guidance. So, as I said, we did meet with the tribal liaison and the director of the Office of American Indian Health. But, these people are busy too, right? So while they're on board, I think, and they want to do more with us, I think there's still that question about, well, how does this work? And we're working on something that's so specific and so focused on water and toxicology and exposures. Like, how can they fit their perspective or their knowledge into our work as well? So I think it's kind of just this opening phrase, that we have available in our sonar. It's kind of like, here it is, we're looking to work with you. It's that way to show that we're interested, and then, let's build off of this. So, we've got a long way to go, I think, but at least we have that beginning stage of trying to engage the conversation and to put it out there that, you know, we're thinking about these things and that these are the things we've done so far as, you know, as far as looking specifically at developmental stages. But also there's a lot more work going on surrounding this. You know, the statement was very focused on rulemaking and our water guidance, but in our whole division, and Lucas can probably speak on this as well, there's a lot going on too that would kind of fold into this as well. So I don't know if Lucas or any of the other group members that are on here today might have more to say about that.
Yeah, I would just add to that too, like the sort of significance of actually taking that first step to really engage these other populations and or these other, you know, groups of individuals that have historically not necessarily had a word in some of these processes. I think that alone is of importance and has quite a bit of significance there. Is that, you know, like you had mentioned, Nancy, we are making an effort to kind of bring in the voices of these individuals, being able to kind of center that their concerns that they might have and how that relates to the work of EH. So yeah, I would agree that it is indeed a work in progress, but equity work is sort of a long game, I would say. It's not something that's going to happen overnight, and taking that first step is really kind of the most important part, is being able to and comfortable to take that first kind of dive into doing that.
And what does that, because equity work is a big lift. So what's the 5-pound weight that you would make in terms, Lucas, in terms of building up that muscle for equity and community engagement when it comes to actually having a two-way authentic relationship with the folks on the ground and marginalized populations?
Yeah, you're absolutely right. It's an incredibly heavy lift. But I think, initially just like making those connections first, identifying the resources that MDH might have, or the groups that MDH has that has that, that specific expertise, that has those relationships with those individuals. So in this example, I would say, with like the tribal communities, connecting, Nancy's group with maybe Raven, our tribal liaison, who has those relationships, travels around the state all the time, and being able to sort of relay that information to them, so then they can, if they're interested and like they would like to do so, can then also collaborate with us. It's like really building sort of upon sort of a trusting relationship that's not necessarily extractive, I would say, because I think a lot of times engagement can maybe feel a little bit extractive. I think specifically within larger organizations, having unclarity about maybe how do we reimburse folks or how do we go about doing this, you end up just kind of informing them rather than kind of collaborating with them.
Great. And I'm going to ask the group, and you can either do this in the chat of like saying, just putting yes in the chat, or raise your hand to say but do you all have connections with staff within your departments that work with, sort of priority populations? I'm going to use that term, or impacted populations. Do you know them? Do you have connections with them? Or, if no, I'm wondering, sort of what do you think are the challenges and barriers to that kind of collaboration? Because I think it's very important, like Lucas is named, and Nancy is named, you kind of have to start from the inside out. Who's working within your departments first in that work, and to be able to understand their context and where you all can be partners with each other, and and then from there work outward with community members as well. So anybody who's had, want to raise their hand and say, we have worked with those people, and I'd love to hear about that. I see Carrie. Anybody else? So Carrie, how has that looked for you?
Sure. I work at the Massachusetts Office of Technical Assistance, which is a state agency that's non-regulatory. It sits within the Executive Office of Energy and Environmental Affairs. And through state statute a couple of years ago, environmental justice was first codified into state law. And so there was a definition of environmental justice, and different agencies within, we call it EEA, Energy and Environmental Affairs, have been tasked with developing an outreach strategy and key agency actions on how we're going to utilize the principles of environmental justice in our everyday work. And through that, there's actually been the forming of Environmental Justice and Equity Office. And so there's numerous personnel within that office that are making those external connections with the community. And then also liaisons. So we have a task force. So within each of the agencies that falls under that structure, we also have liaisons. We do bi-monthly meetings. We also do a lot of work on language access. And I'd say specifically, we're making a lot of traction right now in language access. We've identified vital documents for translation. The state has been helping us with identifying budget to do the translation of written materials, and also some budget for some agencies who do a lot of public meetings to hire qualified interpreters. Where the challenge comes is that in a number of our different offices and agencies are working on various regulatory programs, and they're a little bit siloed. And so we do have folks who are helping us to make those external connections. But a lot of us are tapping into the same nonprofits or the same community-based organizations, or, the same groups of people who are very active. And so the fear is that it's going to come across transactional. Well, this person has a connection, and then we're going to jump on that connection, and introductions are made. But it's constantly, I think, with us, the state agency, having the ask, trying to identify data or identify information. And I think where we need to grow is in terms of partnership and how do we offer that value? Because I think, like a lot of agencies, we don't have the budget for stipends. We just, in one of our advisory boards, we created an environmental justice seat, and we've recently filled that seat. But one of the things we really agonized over as we were advertising for that seat is the fact that we couldn't offer a stipend. So I guess I'd be curious to hear how other agencies are also grappling with this issue.
Yeah. Well, and I want to ask Nancy and Lucas about that, because we can't offer stipends. But I'm going to say, in terms of value, being on the other side in the community and nonprofit field, we love data. So if you've got data to share with us, and especially if you are asking us to help shape what that data looks like, both on the front end of if we get to put in our questions in your surveys, a lot of us would be doing backflips, because that's a lot of labor that most organizations would love to do, but they can't do. And the other thing is, in terms of your offer is, one of the things you can really offer without money is that they get to control the data. They get to do the sense making of that, of when those surveys come out, what, you can say, what is the story that what is this saying about your community? And you can ask them to do the sense making, because we've never have groups not want to be part of that, but they also need to have the on-ramp. So that's my question for Lucas and Nancy, of what is your thoughts about creating on-ramps for communities to really engage, particularly, and know that they're getting something out of it, because transactional isn't bad as long as it's a two-way street, if I want to engage with, somebody, an institution, I want to know my time is worth it, and not because we like each other, but because we're both getting something out of it. So how do you make that case in terms of what communities can get out of a partnership with you all?
Yeah, I guess I can maybe touch on that a little bit. I think it's important for organizations to really understand that there is just simply intrinsic value to being able to center these community voices. TC, like I think you've touched on there, I think most community organizations that are very invested in, whatever field of work it might be, would, be sort of elated to be able to work with a government organization or whatever organization it might be, in partnership. I think that's kind of the key piece there, is making sure or creating a space where some of these community organizations have some sense of ownership. Maybe you're not able to pay them, but they've had a piece and a seat at the table and have been able to really kind of shape the outcome that concerns their specific community. I think it goes back to that, what is the saying, like nothing for us without us, right? Being able to really center those community individuals, those community voices, their concerns, and allowing them to have a seat at the table, to be able to really express those things and work in partnership with that specific organization. I think there is, like, frankly, just intrinsic value to that, even if you cannot pay them.
Nancy, what are your thoughts?
Yeah, as far as my group, we do a lot of, we work with a lot of data, and so we're always looking for data. But as far as actually doing community outreach in our group itself, that would be a new area for us. We really haven't been able to do a lot of that, within the context of what our, statutory guidelines are and our, other limitations. We do have another group in our actually a couple of other groups in our section that probably are able to get out a little bit more and connect with communities as far as, what their job duties are. And, there might be some ways to connect with people that way. They're doing other studies on different communities, what their exposures are, and there's also sites that are found, and, they're finding different communities and maybe, lower income areas or different, types of, variability like that. So, there are opportunities maybe that we could explore, but, we're kind of getting off the ground, looking for ways to do that, which is part of the reason why I've been, participating in this and interested in these conversations. But if there are people, participating here that have additional ideas, that'd be great to know too.
But I think, Nancy, you've named a real value that you can provide because you are working statewide, which is validation. To let communities know, for especially with something as difficult as groundwater contamination, they're not alone and you're available. Just being available and there and showing up is really powerful. So, Katie, do you have your hand up? We'd love to hear from you.
Hi, I'm part of Nancy's group. I'm a toxicologist in the health risk assessment unit, and I just wanted to add that I think you hit it right on the head. A lot of the engagement that we have with communities and municipalities has been to serve as a subject matter expert when they're dealing with groundwater contamination or water contamination, and they need context. And they have a lot of questions. So supporting our other groups within the division at town halls and with those kinds of informative presentations, and just serving as someone who can answer questions about the contaminant of concern has been one of the ways our group historically has interacted. So a little bit, after a concern has been raised to the point of having one of those events, but certainly looking to engage a little bit further up the stream to provide those resources for communities before it reaches that kind of outrage level.
Yeah, and Katie, you're saying something really profound, which is information is power. So when you do that, you're really sharing power. And thinking of it that way. I wanted to lift something up from the chat. Margaret, you said you're working with community-based organizations. What does that look like for you, if you feel comfortable coming off chat and talking?
Sure. Boy, I'm sort of here. I'm phasing in and out. Okay. So my name's, I don't know why my background's doing that. That's very odd. Okay, if I sit there. Hi, everyone. I'm Margaret Sheldon. I'm based out in Seattle, Washington, and I work with IC2 on TSCA issues, but on a totally separate project I've been under a contract with our state Department of Health for some time to work on a longstanding public health problem, which is commercial tobacco prevention and cessation. And one of the key areas in that work is recognizing and trying to actually solve the problem that there are just huge disparities still in who smokes, who vapes, who uses oral nicotine products. And it's deadly. And so when we, I work on a project where we formed a new statewide coalition, and at the core of that coalition is a focus on equity and addressing disparities and on policy and systems change. And in this work, our State Department of Health already provides direct funding to groups that they used to call them priority population contractors. Frankly, we're struggling with a better term because one, that doesn't mean anything to anyone, and two, it doesn't really feel good to those organizations, but it's, it's people of, organizations that truly represent people of color. It's American Indian Alaska Native organization, LGBTQ+. And so we're striving to work with all those groups. They are active in our coalition to various degrees. I think we're not where we want to be, or perhaps where we should be. And I would say the key challenges are, it was mentioned earlier, a lot of those groups, they are really called upon by many people to take a seat at the table. And there's only so many tables they can sit at the same time.
Yeah.
They also have their own work priorities and work plans, and may not always see collaborating with other types of organizations as a top priority, which can be hard for me as a white person sometimes to hear, because I so want their voices at the table.
Yeah.
We want their perspective so that we know we're not doing something wrong or going in the right direction. But you can also see how that puts a burden on them.
Yeah.
To do that. And we similarly have problems in that I really can't pay people to sit at the table with the funding source I have. So last thing I'd mention is I do think, as a former researcher and someone who's worked in local government and worked with state governments, the way we are doing research, the way we are parsing out data does not help these community-based organizations. I mean, on the tobacco issue, just one example, and there's been some great pieces written about it. When you lump all Asian Pacific Islanders together, it really disguises the fact that there are many different groups in that, and there are really different impacts in that. And we can't solve problems if we can't show it's a problem. And so the data is still a really big problem. So I hope that wasn't too long-winded, but I'm here to try to hear about more solutions, because as I said, we've made some progress. We've set a new table and we've brought new voices to the table. But as I said, it's not where we want to be yet.
Yeah. Yeah. And think about what are the tables you can be at for them, as well. What are the things that you can show up for them and build that trust, because oftentimes, it is hard to sort of set the table and invite everybody to come. And sometimes it's a lot easier to carry the water for them, to have those one-on-one conversations and just have coffee with somebody or just call somebody and hear from them and be their voice at the table of I've heard from so-and-so about these core issues and things like that. This is something that's very important to this, that, so-and-so shared with me, because they can't be at every table, but I think you can at least be in right relationship with them to carry their insights, their wisdom, and their, needs and challenges. So Lizette, you went off, you went on camera. Did you have anything else to say, or?
No, not really.
Okay, so we are at time, so I just wanted to appreciate everyone, but closing thoughts from Lucas and Nancy. And my question for the closing thoughts from Lucas and Nancy are sort of what do you think is the power and the promise when we get this right? like in like a minute. Like, what do you think what are you hoping for when you're bringing in people to craft a statement? What's that North Star that you're working off of?
You can go ahead, Lucas, if you want.
I was gonna say, go ahead, Nancy.
Okay. Well, it's huge, TC. It's like, how do you get your head around? But yeah, I guess breaking it down, trying to take little chunks, it's like one step after the next. We've done this statement. I think as a group, we're open to, figuring out ways to try to engage more. We know that communities are affected in different ways by different contamination from groundwater. So we already know that, but trying to apply that and trying to get more voices and helping to, ensure our guidance is truly protective for all communities can be, the bigger challenge. And I don't know if we're going to come up with that in the next, month or whatever, but I see it as an ongoing process and trying to get, more perspectives in there and more data and figuring out how to get there.
Mm-hmm.
Yeah, I think for me, ultimately, it's to the mission of MDH as a whole, really, to improve the lives of of Minnesotans, right? And I see that through really trying to transform, the systems, the policies, the structures that are in place right now to be more equitable and to ultimately benefit the individuals that have been most impacted by a lot of the inequities that have, sort of occurred over history. I think it's a really prime time right now, not only at MDH, but I think more broadly to be able to do this work. There's been a lot of momentum, I think, nationally, and being able to sort of build on that and getting people to understand that, health equity and some of these concepts are really at the core of public health. And in centering those, you're able to have a healthier population, I think is ultimately, the kind of guiding light for me, which sounds a little idealistic and probably absolutely will not happen in my lifetime. But to be able to have a piece of that, specifically within Minnesota, I think is a fantastic opportunity.
Mm-hmm. And, people had kind of like said, like, we're looking for solutions. So I have a couple, but they're not complete solutions, but like paths forward, which is number one of the greatest gifts you can give to communities, especially marginalized communities, is transparency. So be clear about what you can't offer as much as what you can offer, because that means that actually opens up a whole universe for community members and people on the ground to craft an ask and know that their ask will be fulfilled, as opposed to spending time trying to read tea leaves and trying to figure out what can we ask, what can we do. The other thing I will say, and this is something to build off of what I've heard today, is the other gift that you can give to communities is humility. And I think that's been really clear for everybody in this conversation. Of everybody has said, this is a work in progress that we're trying to figure out. We're early in our journey. And when people know that you're early in the journey and people know that you're learning together, they're willing to start calling you, because it is power to help shape everybody's learning as a group. And, I will say, I've always said I've worked with environmental agencies enough to be dangerous. So I'm also on a learning journey with all of you. And I'm really glad Nancy had invited me and opened the door for this, because I'm really excited to come back and really engage with you, because this is really, the stakes are really high, and this is literally the work you're doing is saving lives. And so when we get it right, it means that we do have healthy states and healthy people. So I just want to appreciate Nancy and Lucas for being part of the conversation, and Michaela for putting this all together. And, you'd be happy to come back and we can, now that we're kind of like, aligned and talking, to really roll up our sleeves and like strategize. So Michaela, any wrap up that you need to do?
No, I think you guys have done amazing.
Okay. Well, thank you all for a great conversation. And we can also, Michaela can share the slides as well.
Yeah.
And thank you so much, everyone. Thank you for joining.
Thanks, everyone.
And thank you.
Thank you, everybody.
Bye-bye.
Thank you.
Bye.